pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the Online Pregnancy School as she discusses pregnancy, delivery, and childcare with experts.
Dear viewers, welcome to the Online Pregnancy School. My name is Dr. Linda Vanutu, and I welcome you to another interesting discussion which will help the pregnant woman and the family to know about pregnancy and what they can do to ensure that this woman goes through pregnancy successfully and has a safe delivery. Let's go for a short break. Welcome back. This program is sponsored by Promise Ghana, Vanutu International, Reverse Step, Samsara Ventures, and Erama Clinic. I hope you have been enjoying the program so far. Please don't forget to visit my Facebook page at Dr. Linda Vanutu and listen to our previous discussions. You will learn a lot. Invite friends and invite family. Today we are going to look at another very important aspect of pregnancy, and that is to do with assisted delivery. Assisted delivery. And my guest for today is again an obstetrician gynecologist. Now you understand what that means. His name is Dr. James Boakye. And we are going to look at what happens when this woman is due to deliver and there's a need for the hospital to help her to deliver. And that is what we are going to discuss today. Doc, you are most welcome. Today we are going to look at assisted delivery. What does it mean?
Okay, very good question. So there are certain cases during even the initial stage of the pregnancy, you know that this woman will need assisted delivery. Okay. And then there are certain types of them that you would not know unless the woman goes into labor. You can have assisted delivery during a spontaneous vaginal delivery. That's you are having the baby through the vagina, or having a cesarean section. If it's a cesarean section, usually, for most part of the time, we can predict it when the pregnancy is going on, so we can tell you and you plan. But if it's a spontaneous vaginal delivery, that one you cannot predict it. Because sometimes the baby is coming. Now it's up to the second stage where the woman has to push the baby out. The woman is tired, so we have something called poor maternal effort. Okay. But the baby has to come out because it's in the canal. So there are things that we do, and the most common one we use is called the vacuum. Okay. So the vacuum is put a cap on the baby's head that has, you can actually see the baby's head in the introitus, just that the whole body and the whole head doesn't come out. So you apply a cap onto the head, and then you use a vacuum, it generates some pressure. So with the help of the vacuum pressure, then you can help pull the baby out of the vaginal canal. So that one you may not be able to predict unless the woman goes into labor. Or we have something we call forceps. There are some instruments like metal instruments that you put into the vagina to cover the baby's head. And most of the time, the baby is not lying well, the head is tilted in a certain way, so it's not able to come. So you use a forceps to grasp the baby's head in a certain position and try and turn it in a way that will be able to pass to the canal, and then you bring it out. It's a very nice, exciting procedure if you have the right things and you are doing it very well. And the baby comes out, mother is happy, everybody is happy. So this one's happen during labor, maybe to come out early so that it doesn't get activated, deprived of oxygen in the canal. So we're able to do it nicely, and it's a nice thing. I mean, the mother sees and you are doing it, you can feel that it's coming, and the baby comes out crying, and everybody's happy. And it has to be timely done. And there are processes that you have to follow to do them so that you can get the baby out in time. So for the assisted delivery during vaginal delivery, you can have either the vacuum or use the forceps. In Ghana, we do the vacuum a lot. The forceps can be a bit complicated, so we do the vacuum a lot, which is much easier and more friendly. So we do a lot of vacuum extraction during labor. So that one you may not be able to predict, but you have to be ready for it so that when you need it, you can offer that to the woman to be able to deliver her of a well baby. The other one is the cesarean section. I'm sure we'll delve deeply into it. Where that one, we have things we call indications for cesarean section. That means that there are certain things that when you see, you can actually tell the woman that for this baby, you are going to have a cesarean section. So for the cesarean section, we have two types. The one type is elective cesarean section. Elective cesarean section, when we know that this baby will come out by operation, by cesarean section. So even from day one, we can start counseling the woman that this baby will come out by cesarean section. So it's nice that we can even choose a date. Sometimes we choose a date that is the husband's birthday or the mother's birthday or a certain day that they were born. We can do that for them. And when it's flexible, you can give them a date and then you can do it. I remember somebody said that, no, I don't want a Friday baby because of my experience on Kofi or something. So then you can do it on a Thursday. My father is Wednesday. I'm naming about the father. Can you do it for me on a Wednesday? I mean, in private practice, all that can be done. And then sometimes, I remember there was one incident when this woman said she wanted a Sunday baby. So we were waiting for Sunday to come. But she went into labor on a Saturday. And then I was like, Sunday, I was at the point, Doc, my baby, my mind. So we had to go and then take the baby out on a Saturday. So those ones can be planned. And then there's part of it, another one, that's emergency cesarean section, where that one is not planned. But during the labor, there are things that may happen. And then you realize that, no, you have to take the baby out now to save the baby, or in certain instances, to save the mother's life, or in certain instances, to save both the mother and the baby. So you can have an elective cesarean section, an emergency cesarean section, and they are all forms of delivery. And I'm happy about this topic because, as I was saying initially, people think that if you don't deliver vaginally, it means you haven't had a delivery. It's a wrong misconception. Because sometimes people come and immediately even mention operation. Some of them actually go home and they don't come. They come back in a worse state. So this is a very good program to educate the women to know that it's a form of delivery. Sometimes we even have what we call maternal request. Some of the women come, say, Doc, I want a cesarean section because I don't want to go through the vaginal delivery. I want to have 2 children. So I want to have my cesarean section. And maternal request, if everything is fine, it's allowed. So I want the people to understand that giving birth vaginally and by cesarean section are equal. At the end of the day, we want a baby and a mother. And now, cesarean section is very safe. You come in, we put you don't even sleep most of the time. It's an injection at your back, and you are awake, and we are playing music. Yesterday, I was operating. This woman said, okay, she wants gospel music. I put on gospel music for her. We were all playing and singing in theater. A baby came on. She's happy. I remember I had one woman, she said she wanted reggae music. So we gave her reggae music and we had the operation for her. And when the baby, it's my baby, my baby come out? And one actually said, if I knew it was like this, I would have opted for cesarean section in all my deliveries.
You see, science has gone very far. Ladies and gentlemen, we are talking about assisted delivery. There are some women that want to go through vaginal delivery. Even if they cannot do that for one or two reasons, they still insist that that is what they will do, because in some places, if they know that you did not go through vaginal delivery and you had a cesarean section done, they insult you. They say you are not a woman because you didn't deliver the baby yourself. But Dr. Boakye has told us that whether it is by cesarean section or by vaginal delivery, all we want is that the woman will be healthy, the baby will be safe and in good condition after the baby is born. This program is proudly sponsored by Promise Ghana, Vanuatu International, Reverse Tap, Samzara Ventures, and Erama Clinic. My guest for today is an obstetrician gynecologist. And he said that during cesarean section, they were even able to play music for the woman. Isn't that beautiful? Isn't that beautiful? Doc, me pocho say obi banas was obeyen assisted delivery ha. Oche den abazina waye ma dem besia no.
So, and I make there assisted delivery no, you will be home you can predict it. And everyone so you cannot predict it. If it's vaginal delivery, the woman or labor ward, why dilate up to 10 cm, but what bread unto pushy, pushy. We have something like a friend of vacuum. I don't know, yeah, the bed kitchen colanity, but the bed catanity like a hat, like a cup. Then it generates pressure. Then it helps us pull the baby out of the vagina. So we are assisting the woman, we are helping her. That's the assisted part of it. Sometimes you'll be having a forceps. I know you hold it or this sometimes because baby no but because knitting on day, then you turn it in such a way there. Knitting the then you pull it out nicely. So those ones you may not be able to predict it unless it happens in labor. But then we'll tell you, because you need the cooperation of the woman to achieve a successful vacuum or a forceps delivery. Then there are another type of an operation that I look at CS. Everyone says CS, cesarean section. I don't know, it's an operation where you be trapped with baby no out. Some conditions or more. I know in the anima. Nami hua, this baby, the best and the safest for the baby is to come out by cesarean section. From the beginning, we can even choose a date and then we do it on that particular date. So it's known. So the annual elective cesarean section as a planned cesarean section. And I want emergency cesarean section. I don't know what happens during the labor. No? Then maybe the woman begins to bleed or baby no heart, no kofum. Until we want to hurry up and get the baby out. And if the baby, it's not easy to have a vagina, the fastest way to get the baby out is to have an emergency cesarean section. So you can have an emergency cesarean section and then you take the baby out. But in all of this, you counsel the woman because she has to give you consent. There, do what you are going to do. So you better tell the mommy, "Sis, ya baby, I will do no." Or there, operation more. If sometimes the husband who are around and any papa and any mommy will even call them and then talk to them, so they all agree that go ahead and then do the operation. So we go ahead and then we do the operation for the woman, and then we are. Baby no walk ni mama ho. And as I was saying, since your operation on you today first now obi cooperation now what's a years since your operation cry and that you don't sleep, you are awake when you do na you bon komo, and a few of the people will tell the theater at the pan because everybody can say market home and you can theater and can baby theater you can them until you are awake. Then we are operating and then you can see everything like not what we are, but the baby comes out, you can hear the baby crying. We are talking to you and we are doing operation. So I'm happy about this program. I'm saying it again because, as you said, no, there are certain people look at it. But it's a wrong conception. And it's sad to say that some women have actually lost their lives because of this misconception.
Yeah.
Because they came and they catch one day, or they your operation, baby name no. I mean, operation dabi. Now sometimes they've been around for why you late. Then you can't help them, or they come back in a very worse state, and whatever you do, you can't save them. So people should know that there are forms of delivery, and every delivery and pregnancy is different.
Yeah.
In your first pregnancy, able to walk vaginally, but in the second pregnancy, something may happen. Or there operation now. After the operation, it's possible there able to walk one kasa. Your operation, it's possible after that, if everything is okay according to our assessment now, able to allow our kasa. Having delivery, it can be assisted, or you even having your own, having delivering the CSR, run away and then go and hide somewhere. And sometimes, unfortunately, I have to say this, they go to the prayer camps.
Yeah.
The doctor, pastor, doctors are doing operation. And unfortunately, some of the pastors will also dabi operation on parallel. No, watch your prayer camp. I don't know why late.
Yeah.
We've lost a couple of people like that.
Yeah.
They're coming, some of them actually coming already dead from the prayer camps. So they shouldn't run away when we are told that they'll have an operation. It's a very safe procedure, and all things being equal, all that we want is a healthy mother and a lively baby, and the mother and baby are fine. So it's a misconception. That's a very bad one, and they shouldn't hold on to it. They should let it go.
Okay, Doc. Thank you very much. So, what are the indications? Before we come to the complications, what are the indications? Apart from one, or other way an operation, emergency one. What are some of the indications for a cesarean section?
Good question. Indications in OAP, but we'll try and go through a few of them. One of the common indications is if say enwoda, na say echo hospital, na where scan, na time baby no when in what 38 weeks no, na baby no the need to by friend breach, knitting or there say baby no or your tema knitting no back why I say. That's what we call cephalic presentation. But if we are done, nani foam, knitting or sura, and a breach. Research has been done all over the world, and it's been shown that say if enwoda, na say baby no or the breach na oba, the best way to have a good delivery for the baby and the mother is to have a cesarean section. But because of the way the baby is presenting, the Becca and they know for this one, the best thing for you to have is a cesarean section. So we call that primary with breech presentation. I know what the cesarean section. We can tell you and you can plan and we do it. And then if you have had operation ABN 2 times, the third one has to be a cesarean section. Because if we don't do that and you allow it to go into labor, we call something uterine rupture. Uterine rupture and I want to know better my pie. Maybe I palm first, no. Why a week? Can't to better my pie. No pie, a baby bleed. And if a pie at the wrong time, a bleed na ye hua. And then be want to say any hospital, you can actually lose your life because of bleeding internally, and the baby can also die. It is a operation 2 times, I know, or a dolly, or they plan and a CS more. And today, I operation again. Not till you come to the clinic today. Maybe you have early pregnancy. I can tell you that good. We are taking care of you, but this pregnancy you have a planned cesarean section. So that will be an elective cesarean section, and then we'll have it. Now, sometimes it's so there will be on you twin gestation and twin gestation. No, baby, no twins, no only no problem. But about the people are twin, the first one, or the need to never the breech one. Yeah. Once the leading twin, more or at a pain, or a breach, we have to do a cesarean section because research has shown that if you don't do that, there are complications that can happen that you may actually lose both babies. So if you have a twin gestation and the leading is breech, we do an elective cesarean section. Okay. And then sometimes you have some people too, the baby is just too big. Mm-hmm. We call that macrosomic babies. A baby, baby checking weight, maybe at 4.5 or almost sometimes 5 kilos by scan. I don't know. You have to allow. We don't want to allow for vaginal delivery because they can have complications, prolapse, and other things. So you want to plan and have an elective cesarean section for the mother. So the baby is too big, and then you can do that. And then sometimes we have people that they have short, and be on what height, on what when you do that, the pelvis it's not adequate enough for baby to pass through. Yeah. So very, very short stature. And I don't know, because you don't want complications, then you cancel them for an elective cesarean section. So and also it's an indication for a cesarean section. Sometimes after birth, I won't nature then placenta or there or hang through hormone. That is the normal way for it to be. But sometimes it happens there. It comes and covers our dinano. We call it placenta previa. And we have types. The major type of the placenta previa is a planned cesarean section. Because if you don't do that, or started or labor now within it, she start bleeding and it can be a death sentence. So if you have a placenta previa, a major one, then you want to plan and have an elective cesarean section. Sometimes also we have something we call lower segment uterine fibroids. Fibroid, that's the most common disease in a woman. But sometimes we want fibroid, why also the baby fiber. So there's no way the baby can come out when the fibroid is blocking the entrance of the womb, the cervix. Yeah. So that one is a lower segment uterine fibroid. The baby will not come, and we can predict it before she goes into labor. So then we tell the woman that look, so and so and so, this and this and this and this. So we want to have an elective cesarean section and then take the baby out. In certain circumstances, we can actually do both. We take the baby out and remove the fibroid for you at the same setting. When everything is okay, there are certain things you need to do, get blood, and the person doing the thing has to know what it's about. If the person can do that, we can actually do both for you, and then we take the baby out for you. And then sometimes, for some reason, some of the women also come, and then they say they want an elective cesarean section. They have their own reasons, and we call that maternal request. I mean, sometimes maybe a baby or a special day be for her, and she wants to have the baby on that day, and she wants a cesarean section. So yes, we can have an elective cesarean section for her. And then sometimes, which is the commonest one, when the labor is going on, baby heart rate, or there or between a certain normal value. We are checking to see that the baby heart rate is fine, the contractions, and the labor is progressing. But sometimes, when the labor is not progressing, you are checking and labor is not progressing. When labor is not progressing, then the labor is failing to progress. You have to intervene and take the baby out. So that is also done. And then sometimes, even during the labor, the baby goes, the toilet that the baby goes. The baby can have meconium. I mean, it stays there. Sooner or baby, why like, why you take into my baby breathing. And then when the heart rate, is coming down. And that one, meconium stay like grade 3, bad one. It's an indication to have a cesarean section, especially if it's in early labor, so that the baby does not go into distress. And then sometimes we have conditions, maybe the woman has BPR cholesterol, until we are doing something what we call induction of labor, which is now the woman call forced labor. This induction, all that induction is that the car, battery, or the battery on sparking. Now, a push car or jump start it, then it takes over on its own. So what we do in induction of labor is that we give you some medicine, and that initiates the labor. The aim of that is to make sure that you have a vaginal delivery. But for some reason, we don't achieve that. So we call that failed induction. And there are lots of reasons why induction can fail. So if the induction has failed, then you want to go in and then have an emergency cesarean section for the woman so that you can deliver her of the baby. So these are the commonest ones that we have, that you can have an elective cesarean section or emergency cesarean section. But in all of this, the woman will be cancelled. We'll tell you that this and this and this. So because of this, we have to do this for you to get the baby out. You agree, you sign the consent form, we take you to theater, and we'll do the operation for you. Mother is fine, baby is fine.
Gentlemen, this is the online pregnancy school. My name is Dr. Linda Vanotu, and we want pregnant women to understand what is happening to them and also have healthy babies while they also stay healthy. My guest for today is Dr. James Boakye. He's an obstetrician gynecologist. And today we are talking about assisted delivery. You know, he has said a lot. There are a lot of indications for a woman going through cesarean section. He has given us a lot of the indications. Now, what we want to understand is that it is not just that they want to help you to deliver. No, they have a purpose. And from the indications that he has given us, you realize that there are various reasons why a woman would be taken through a cesarean section, or they would use the vacuum, or they will use the forceps. But the bottom line of it all is that they want you and your baby to be healthy at the end of pregnancy and delivery. Amafo, in the online pregnancy school, no, why you need to do? Many Dr. James Boakye na yerekasa, or your obstetrician gynecologist. And when you call one real war, or yem besiafo honishahu, of a minsan, and besiafo, Zelbe to my one. Now, some under yerka was me only brofum yes assisted delivery. We have heard so much. Let's visit the hospital and see what goes on.
My name again is Dr. James Boakye. I'm an obstetrician gynecologist. I see two women, as we've been discussing. And from the discussions that we've had, we've talked about cesarean section. So this morning we are privileged to have a live session, a live recording of a cesarean section. So we'll go through the stepwise ways of delivering a baby via cesarean section, just as we discussed on the show, so that you know actually what happens, and then you can understand really what you do. So just follow the procedure step by step, and then I hope you understand it then.
I hope you enjoyed the trip. Welcome back. Doc, thank you very much for taking us round what is done at the hospital. But as we go on with our conversation, please, is there anything that the woman has to know as she prepares to come for a cesarean section? Is there anything she has to know that she has to do before she comes for the cesarean section?
Thank you for that question. So, I mean, when it's a planned one, so you are told about what is going to be. Usually, today, when we do the operation, the day of operation is day 0. So you don't count that one. The next day is day 1. The next day is day 2, and then the next is day 3. So all things being equal, by day 3, you are fine, and then we'll let you go home. We'll check everything. Once everything is fine, we'll let you go home. And then now, when we do the operation, in the past, when I was a house officer, we were using the stitch that after 5, and then remove the stitches. Now we don't do that. Okay. We don't remove stitches anymore. So when you go home, you don't come back for stitches removal. And I know the woman didn't like that. We don't remove stitches any longer. I want to do cesarean section. Okay. And then when you go home, when the wound has been removed, please have a bath. You can have a bath. You can, it's important. You can have a full bath. When you finish, then you clean the place nicely. Because people go and then they come back and say, oh, maybe in great operation, and then you get infected wound. But you can have a full bath. Once the plaster is off after the 3rd day, you go home. You can have a full bath, you clean the place, and then you dress it up. So it's open wound dressing. And now when we do the operation, in the morning, let's say 6 o'clock, in the evening, by afternoon 12, some people are even working. And then by 6, some people are even working and they started drinking certain things. So having water and things like that. So that can be done. So we will tell you that at least you'll be in hospital for 4 days so that you can plan your life. If somebody has to take care of certain things that you are doing, then you can let them plan that for you. And then when you go home to, you are up and about. You can walk, do everything that you've done. And I have clients when they come and say, so this is how cesarean section is. Wow. Because, and somebody say about pain. There are drugs for pain. We are not wicked people. During the operation, you'll be given drugs for pain. After the operation, you'll be given drugs for pain. When you are going home, you'll be given drugs for pain. So the pain is also taken care of. And after cesarean section, you and the one who had the vaginal delivery, you are the same. So you should start breastfeeding your baby. Your baby, you start breastfeeding the baby, which is very important. The bonding with the mother, the baby. So it's the same. It doesn't mean that when you have a cesarean section, then you can breastfeed. Everything is the same. The only difference is that you had a cesarean section and this one a vaginal delivery. But after that, everything is fine. And obviously, because you have a wound which is bigger than somebody who had the vaginal delivery, you'll be a bit sore. But we'll take care of that with drugs. Okay. There's medication to take care of that. So people should not worry. But it's just that we don't do cesarean sections unnecessarily. We don't do unnecessary cesarean sections. Because even the WHO has a cesarean section rate, it should be at a certain level, because we don't want every woman to come for cesarean section. So we don't just get up and do operation or do cesarean section. But when we say we want to do it, that means that it's important for us to do it. So when it gets to that level, they shouldn't be afraid. It's another form of delivery. And another point I want to make again and say again here is that every pregnancy is different. Mm-hmm. So you shouldn't say that because my first 2 children, I had a vaginal delivery, it means that this one, if it happens that I have to have a CS, it's a no. Labor and delivery is dynamic. Mm-hmm. As one of my professors, Dr. Biakubi, he will tell you labor is dynamic. It's an art. It's an art. So, you do this and that. So it's an art. So it's not one way fits all. So when it gets there and we want to do a cesarean section, it's allowed. We'll talk to you about it and we'll take you in there. You enjoy the theater, we'll do it, and then you will come back. So we can have a vaginal delivery and a cesarean section. They are all forms of delivery. So let's learn to accept them as such.
Let's learn to accept them as such. You know, cesarean section means that the doctor, the nurse, the anesthetist, all of them have to come together. So it takes more time and it takes skill. So they will not just do it if they don't have to. It will be done because of the life of the mother, because of the life of the baby. That will be the best decision that they have to make for you, the mother, for the baby, and in fact for the family and for the whole country. We have heard a lot about cesarean section, about assisted delivery. Do not be afraid. Don't be afraid. The people there are just as human as you are. He said that they will take care of the pain. Menstru, Seko Hospital, Wakacho there. Mami winning sani, Osan in Zamo Kenny na Ebiana was in Wabater. I was in nature, I don't know. The offering the placenta, Biana Wabater, I know her. A quani bia and you home my baby over to Mafumaba. I'm sure you can with your tumor, if him, never watch him. Into Seko Hospital, Nasa wash your phone was a banusho or sundodo. Me pocho menka de ami was the second run come da into my dodge ekwa ebaba no na mbere apa ho ye hu bebre obi o ho agwa antenatal necessary won na ye fine wo pena sampa wo kitchen de obey cesarean pe we gwan. Unfortunately osa na ebe no na baby na efim na maami na asonso we efim onyi do bendam nda was otum bonyumpo mo nta bedinti na egbogwan mengwan mopocho Seko Hospital mo baka cho no dido obabo pi dido. This is the online pregnancy school. My name is Dr. Linda Vanutu, and today our topic is assisted delivery, and my guest is an obstetrician gynecologist. He works at the Lekma Hospital in Greater Accra. His name is Dr. James Boakye. He has said that a lot of reasons why a woman would go through assisted delivery. And for those of you who think that if you go through assisted delivery, it means you are not a woman, that is a wrong perception. Because at the end of pregnancy, the woman should be alive and the baby must also survive. That is why we bring you this program. And having gone through the hospital to see what is done, I'm sure your fears will be allayed. That next time if you hear somebody going to the hospital and coming back to tell you that they told me I would have to go through a cesarean section, because of this program, you'll be able to counsel this person that run, go quickly and let it be done because it is good for you. And when you go home, we've been told, able to me send for my answer, able to my mobile nufu, able to my tanwa bonkomo, and able guaranso. Me pocho da membrane wapa ho de obi nyinsa na okọ hospital in operation a ekofi a wase me ngwa ros wapa ho o san de binu obaba na echizi kru no wa ye wa nka bem onu mo mba ha wadwen o so no nya wapa ho sisi andama pi aye fofor nti yepa ho nchew se erikofie na ntinze me bia se ya bisa midwife no ana bisa doctor no ba no pa na orehwe wa bisa na asende are wo bia obeyi wa no. Doc, now somebody would want to know, what are the complications? We have spoken so beautifully about assisted delivery, but are there any complications with assisted delivery?
So, yeah, thank you very much. So, like in every procedure, every operation, there are complications. But before I even go on to talk about the complications, let me say that these are, let me say, the fine print, and that is not the norm. That is not what happens, but they can happen. In weird few cases, once a while, they can happen. In a cesarean section, one of the commonest complications that can happen is that after the cesarean section, and even normal delivery or assisted delivery, we have something we call uterine atony. And we are, the uterus has to contract, becomes hard like a stone, so that the blood will stop flowing out. So that you don't bleed out, because a lot of blood goes into the uterus. So if you are still bleeding, then you'll be losing all your blood. So there's something we call uterine atony. And it can happen both in assisted delivery or even your spontaneous vaginal delivery and a cesarean section. And when that happens, there are a lot of things that we have to do or we can do to stop the bleeding. sometimes if it wasn't a cesarean section or even a cesarean, we have to go back to theater and do some things. I mean, there are a lot of procedures that are too technical. We have the B-Lynch procedure, which sort of makes it tight. We can tie some of the uterine arteries, ligation, internal ligation, all those things, trying to save the uterus. In especially Ubia, who has only one child and has reproductive wishes. When we have done all of these things, and then the bleeding is not stopping, the last resort is for us to take off the womb. And that's what is called a hysterectomy. And we do that as last resort to save the woman's life. Because there have been cases where you are trying to save the woman's life and you don't do the hysterectomy, and by the time you realize, the woman has lost all her blood. So those are some of the complications that you can have. And sometimes, unfortunately, you can do everything that you would do. You can do everything that you would do. But then the inevitable happens. And then we have a maternal mortality, which when it happens, it's a big thing. I remember when you're in Greater Accra, when it happens like that, then you have to summon everybody from the smallest doctor to the biggest doctor. And then we all have to come to the Sanhedrin and explain why it happened. Because it's something that doesn't happen often, and something that the region, the district, the national, and even the world at large takes it very seriously. Maternal mortality. Nobody wants that. Unfortunately, sometimes these things happen, and these are some of the complications. It's the least common of the complications, but once in a while they happen, and we don't take that one lightly. So by and large, those are the common complications of cesarean section. Another complication that may have maybe anesthetic complications, because we need to give you anesthesia so that when we are operating, you don't feel the pain. So there may be anesthetic complications that can be reversed, or sometimes they may also lead to us having a mortality. But these are not the norm. These are the fine print that doesn't happen often. And as I said, you know yourself, when you're in office, when it happens, what happens? A whole team is there's an audit, a serious audit that comes on. So those are the complications that happen. But by and large, it's not the norm. It's not the norm. But these are some of the complications that can happen during a cesarean section after delivery, and even a normal vaginal delivery. Because somebody can have a normal vaginal delivery and still have a uterine atony and maybe bleeding, and you have to go in and then open up to save the woman's life. Or it can happen during assisted delivery, and it can happen during a cesarean section. But usually when they happen, we dive in and then we arrest the situation. But as I said, in a few cases, you can do everything that you can do, but you still end up with a mortality, and it becomes
a sad news for have this program. This is the online pregnancy school. My name is Dr. Linda Vanutu. The goal of this program is that pregnancy should be a time of joy and not anxiety or fear. And that is why we talk about maternal mortality, but when it happens, we don't take it lightly at all. Our prayer is that every woman would know when to go to the hospital, and the doctors and midwives will also know when to give an intervention. And that is why we have assisted delivery, as we are talking about today. My guest is Dr. James Boakye, an obstetrician gynecologist. He works at the Lekma Hospital in the Greater Accra region. Ladies and gentlemen, let's go for a short break. Welcome back. I hope today you have learned a lot about what is meant by assisted delivery. Enuanum inde yati bebre dese besia enyinsa na rekwa akwo na ekọ hospital na se wose ode ye bibi na ye de boa ma ebe oba men dwen de ono nche de ye besia eye besia pepepe osande etu me enyinsa awoba eye besia ena hon so sha oya wodwen de so bi ko hospital na way na operation o che de onye besia ebi adakuru bi no wose na ware ye besia erewon wa na ewo ya nya hospital nya doctor na owo ma wa memo fo no ya asam osande na sanu hu hia ncha wonye sa doctor fu okeje ono wa ye cesarean section na oyember oyenzeme bebre na okom nti so ohia wonye nti mpawonchaw womyemfo ntu hia ho fu de besia se kwawe na wara na ewe fa waso se bi o se ewe na wawe operation no se wada de twio se waye nde no awo na awo besia memo ho p memo ho kra memo ho doc. Please, now we are getting to the end of our conversation. What are your final words for the general public and for this pregnant woman and the family?
Thank you very much, Doc. I'm going to say that this is a very, very important topic that you choose. But I want to tell my sisters and our wives and our mothers out there that when you come to the hospital, you should also ask questions. Don't be afraid to ask questions so that you also get involved in your care. You know what is going on, how many months you are, how many weeks you are, what is happening, if you are going to have an elective CS, when it's also going to be done. And when it gets to that point that for you or for that particular pregnancy, it has to be by an assisted delivery, where in this case I'm talking specifically to a cesarean section. Don't think that it's something out of space. It's another form of delivery. So don't go and hide somewhere and only come in when it's so bad that you've had complications. And know that we are there because of you. When you are going to do one cesarean section, come and see the team. You have 2 doctors at least. You have an anesthetist, maybe 1 or 2. They have an assistant. We have a scrub nurse. We have somebody in the theater also going around. We call them running for us. So about, let's say, 8 to 10 people, just because of you, this one person. We have a midwife in theater receiving your baby. So just because of you, all these people are there for you. So we are there because of you. So be rest assured that when you come in, you are going to get the best of care and you are going to be treated. If you don't have any questions, you ask. Don't be afraid to ask questions. I actually like my clients to ask questions. Ask and you'll be explained to why certain things is going to be done. Because when you understand, then you accept it. And at the end of the day, you enjoy your theater experience or your assisted delivery because we've talked you through it, you accept it. And again, I would say that having a CS does not mean that you are not a woman. It's another form of delivery and it's accepted all over the world. All over the world. So let's fall into it and let's make sure that we help us so that at the end of the day, we have a help.
Doc, but somebody would like to know, can the husband come and stand there whilst the cesarean session is being done? And can he take video or photos?
Thank you very much for this question. Sometimes in private practice, because in our public hospitals, the suites are not very private. So, and you come there and there are a lot of naked women there and emergencies and the way it is. No? It is not often that we allow people to come in, the men to come in, but we do it. But in private practice, it's done all the time. Even yesterday, I did a cesarean section for a lady and the husband was with us in theater. And I tell the men that if you are good, when I say good, it means that you come for antenatal with a woman, I see that you are interested. Sometimes I even allow them to cut the cord even in theater. Yeah. To have the experience, they cut the cord in theater, and then sometimes you allow them to take videos. So yes, we do allow them in certain circumstances. But sometimes in public practice, when there's a lot of cases lined up, and if we say we are allowing everybody to come in, it may not work like that. So it's a bit restricted. But even then, there sometimes we do allow. But in private practice, I know that it's the norm not the exception. Most time, man was allowed to come in. Yeah, with the woman giving them kisses, holding their hand, or doing whatever they are doing. We are doing an operation, and the man is there. The woman is also there. So it's a very nice experience. And as I said, if I see a man who I say you are good, I said you come for antenatal, you come with them, and we allow even to take out the course sometimes in theater, and you enjoy the experience. So that can be done if you can stomach it. Some of the men will tell you, no, I can't stand it, so I can't come. Or some of them say, my husband, if you bring him, he'll collapse, so don't let him come. Yes, but some of them are brave and they come in. And I have a man who has been through all the 3 deliveries. He's been there with us in theater, so he knows, and then he enjoys it. So it's done. It's allowed and it's done. It's just that because of the pressure and then the numbers in public facilities, sometimes we don't allow that because you can't allow that the way the setup is. But in private practice, usually is the norm and not the exception. But even in public practice, sometimes we do allow them to come in. So it's done. It's done.
It is done. Ladies and gentlemen, let's go for a short break. Welcome back. Today we have had a very wonderful discussion on assisted delivery. The men, please, I always come to you that show interest. When your wife goes for the antenatal and comes home, please ask what was said if you cannot join her. But the best thing is that go with her from time to time and talk to the doctor, talk to the midwife. Ask about what is happening to that baby and even to your wife as well, please. And today we have heard that if you are strong and you can stand it, some of them, when they get into the theater, after a short time, you find the knees becoming weak. Even then, they'll give you somewhere to sit. But if you want to join your wife in theater, it will be very, very good. They will give you the gown to wear, and then you'll be told what will be happening so that you prepare your mind before you get there. And if your wife is going to have an elective cesarean section, it will be good for both of you to go and see the doctor whilst he's counseling your wife, so that you also get to understand what will be happening. Then you can support her and join her to the theater. We encourage that. I hope you have enjoyed today's discussion. If you have any question, the WhatsApp number is on the screen. Don't hesitate at all. Please send me a WhatsApp message on anything to do with pregnancy, childcare, reproductive health, and we'll be very happy to answer that question for you. Today, my guest is Dr. James Boakye, an obstetrician gynecologist who works at the Lekma Hospital in the Greater Accra region. I try to mention where they are so that if you have any follow-on question or you want to know more about something that we have discussed, you can visit that hospital and ask for him, and he will be very happy to listen to you and also help you out. That is why I bring you the people that I bring you, and we discuss the various topics that we discuss. My name is Dr. Linda Vanutu, and it is always a pleasure to come your way with the online pregnancy school. Doc, I want to thank you so much. There are other topics that we'll be discussing. One of them you mentioned, fibroid. So very soon, we'll talk about fibroid for people to know what it is and what can be done. So I hope that viewers, you'll be watching out for that. Don't forget to visit my Facebook page at Dr. Linda Vanutu to go through the various topics that we have discussed so far, and then visit my YouTube page and subscribe so that all the other ones you'll be well informed and you join us. Please share with friends and with family. Enjoy the rest of the day. Bye.
Pregnancy should be a time of joy and not anxiety for the woman and her family. Do you want to learn more about pregnancy or have questions about fertility and reproductive health? Then join Dr. Linda Vanutu on Facebook and YouTube every Saturday at 4 p.m. on the online pregnancy school as she discusses pregnancy, delivery, and childcare with experts.